Hey Two Warriors, thank you for tuning in today. I want to share with you some of the hot topics out on the forum. Is pharmacy a good career to pursue? And I've actually got a few emails from some of you guys asking the same question. So I thought, why not create a video and talk about it? So first off, is pharmacy a good career? I believe you have to ask yourself the questions, what are your goals and what is your passion? If you're saying, I'm good at math and I think pharmacy is a good career, math and science, then maybe not. You gotta choose a career that you love and that you're also very strong. So in addition to passion, you have to be strong in the skill sets. If you're not very good in science or math or even dislike it or hate it, yes, it will be a painful process for you to go through. Anything in medicines, right? Pharmacy, nursing, physician. So with that, I think you have to look inside yourself and reflect, saying, what are the strengths that you have in terms of skill sets, especially when it comes to math and science, because in pharmacy there is a lot of math involved as you go in through the undergrad process, but also in pharmacy school. So that's kind of the basic foundation question that I want to make sure you guys reflect. The second question I want you guys to also consider is how many years of schooling you're willing to give. So pharmacy school, right now they don't require a bachelor program to get into pharmacy school, but it's highly recommended. So at minimum is 2 years of prerequisites and 4 years of doctor of pharmacy. So that's a total minimum of 6 years. If you get your bachelor, it could be 3 to 4 years. So you're looking at 6 to 10 years, right? Hold on, 6 to 8 years. I'm counting residency, sorry. So let me finish. So you're looking at 6 to 8 years of schooling for a doctor of pharmacy. In pharmacy school, you don't necessarily need to do a residency like a medical doctor. However, you can do an additional 2 years, 1 to 2 years of residency to get more specialized. And that will be another 1 to 2 years. And the 2 years, so that's where the 10 years come when I was mentioned that. So you're looking at a total of max of 10 years if you want to go for the full-fledged from undergrad pharmacy to residency, or just start out 2 years of undergrad and then 4 years of pharmacy school. So that's 6 years. So first of all, what are your strengths? What are your skill sets? And then how many years of schooling you're willing to go through? And then the next question is what kind, and you probably don't know this for those who are watching that are not in pharmacy school yet, or even those in pharmacy school, you may not know what kind of specialty you're interested in, right? So the most 3 common areas that pharmacists work are hospital, community pharmacy, so it'd be Walgreens, CVS, grocery stores like H-E-B, Target, to name a few, and then our industries. Those are the 3 main ones, or an independent pharmacy, of course, and then industries, like working for pharmaceutical companies. So those are the 3 biggest sectors. However, know that there are other opportunities for pharmacists to make an impact in the public health as well as federal government, like the FDA's, so Food Drug Administration. So there are just a lot of options. But I think the biggest piece is that you gotta think, if you want to be in pharmacy, why you want to become a pharmacist and what are the reasons. So pharmacists, we do, we help to work with our healthcare team, so nurses, our healthcare providers, to ensure that our patients' therapy is optimized and the medication they're on are appropriate. Physicians are great at diagnosing, and they go through the physical assessment and see what's going on with the patient, and then we help our doctors to make sure that the therapy and the regimens are either no adverse drug outcome, no drug interactions. There's just a lot of things going through a pharmacist process when they go through the orders as well as recommendation for a therapy. And then now I want to cover kind of the big questions. Is pharmacy worth it? So I think for me, it is definitely worth it. I did a 3-year program, so I got my bachelor before I went on to do pharmacy school. And I thought that was something that I want to do, and I want to enjoy my undergrad. So I did that, and I went to study abroad. And then I went to pharmacy school at the University of Texas Austin College of Pharmacy, which I thoroughly enjoyed. They have a very supportive group of faculty, and then, just being in pharmacy school, you are along with your peers. So I felt like I got a lot of mentorship along the way. And then I decided to do a residency, a 2-year residency in pharmacy administration and leadership. And that's where I was mentioning if you want to get further specialization. So the big hot question is there a job after I finish pharmacy school? I know there are a lot of talk about, there's market saturation, it's really hard for me to find a job, etc., etc. Which there is some truth to that. There is definitely, if you're not as flexible and you want to only work during the day, 9 to 5, and you only want to work Monday to Friday, then it's going to be hard as a new grad. I'm not going to lie. And if you want, let's say in community setting, you want to be like the PIC, there's not going to be a store for you right off. As with any learning experience, as you're new, you need to build your credibility or put in the hours. So that's one thing I want our students to understand, that when you get out of pharmacy school, there's not going to be a job given to you. You got to earn it, in a sense that you have to be flexible, be willing to travel, or be willing to work on odd shifts and work maybe at PRN elsewhere. I think there is a greatest need in the administration leadership. As you know, there are baby boomers, so hence there are patients are aging, so they would definitely need the help of a pharmacist. In addition, we also have many pharmacists retiring, so we need more pharmacy students to step up and fill that gap. The area that I will say has the greatest need is in leadership, so in management, manager and director role. So I feel like there are job opportunities out there. You just have to make sure that you're prepared for it. And that's one of the reasons why I chose to pursue a residency and did my administration. So I will sum up in terms of, is pharmacy still a good career to go? For me, it is, and I feel for some of you it will be, but I think the biggest question lies, is it something that you can see yourself doing for 20, 30 years? And before you even start exploring pharmacy, I would recommend to start working as a pharmacy technician or work as a cashier in a pharmacy in a community setting and see if that's the environment that you like. Like I said, there are many opportunities in pharmacy, but if you're not a pharmacy student or pharmacist yet, it's really hard to get in. It's one of those very competitive. The first entry point that you can get in is in a grocery store as a cashier, and kind of get a glimpse of that in terms of what does a pharmacist do in a community setting. And then the other aspect is getting volunteer at a hospital into a pharmacy and kind of talk to pharmacists. The best way to really understand what a person does is trying to shadow them or talk to them as much as possible. Of course, you don't do the job, so you may not know the ins and the outs, but at least you can kind of feel, okay, I like that. I think that's really cool. Like, it's something that I can definitely do. And that's what I did. I shadowed a clinical pharmacist in a pediatric hospital, and I felt like, wow, this person is so knowledgeable about medications and really working very closely, and the doctor are taking his recommendations very well, and in the end the patients are well due to the recommendation, the work that you provide. And that's the reason why I chose to go pharmacy. So I hope that was helpful. I know it's a little bit long than you would like, but for those that are interested, please post comments, more questions. I would love to answer. For those that are already in pharmacy school or are pharmacists, please post comments on your experience. I know on the internet, on YouTube, I see a lot of pharmacists that are burned out and they either walk away from pharmacy or choose a whole different career path, which is perfectly fine. But I also just want to share my piece of insights on, I think pharmacy is still a great career. I think it's just the matter of you got to make it work. And more important than that is that you got to make sure it's what you want. And before you even know what you want is, know what the role is and see if that's something that you're even interested in doing. So guys, feel the love, share, comments, like this video, hit the bell button for more video coming up, and subscribe to my channel so we can build this great community. Thank you so much and take care.